It's a great pleasure to be here. I, Sonal Christie, clinical instructor at Parul Institute of Nursing, extending my thanks to all for joining us for today's guest talk. Today, we are presenting a guest talk on clinical performance evaluation through OSCE. During the presentation, if you have any query, please drop into a comment box. OSCE is an innovative evaluation method that often used for assessing nursing student clinical skills. The OSCE consists of a scenario based assessment in which a student was required to demonstrate safe assessment and management of certain skills. The OSCE is gaining popularity and taking a part of practical examination in medical and paramedical in present era. So, to explain in detail about OSCE, we have a special guest, Mrs. Sushila T. from Nimans Nursing College, Bangalore. Madam has completed her BSc Nursing from the Dr. MGR Medical University, Chennai, and MSc in Pediatric Nursing from Vivekanand College of Nursing, Tamil Nadu. And she is pursuing PhD in Nursing from Yenepoya deemed to be University, Mangalore. She has 15 years of experience in teaching and administrative work. She has many national and international publications. She has presented paper in many conferences and she has special training in life skill training from Department of Epidemiology Center from Public Health Nimans, BNCRP course of IAPNNAF Neonatal Resuscitation Program. She was a resource person for many national and international conferences, workshops, and seminars. She is a research guide for MSc and BSc students. She is scientific reviewer for MSc thesis. With these words, I would like to invite Mrs. Sushila to proceed the session. Ma'am, please.
Thank you. Thank you. Slide is visible. I could not see the slide.
I'll share it, ma'am.
Okay.
Ma'am, this is visible?
Yes, but it is not in slideshow mode, but we will manage. Please try. Yes, it has come.
Okay.
Okay. So very good afternoon to one and all. It's my great pleasure to meet you all in online session. Okay, so let me start the presentation. So clinical performance evaluation through OSCE. Next slide. Next slide. So these are all the learning objectives I'm going to discuss with you people. Introduction, evidence of OSCE, gold standard, content and process of OSCE, component, types, OSCE, setup, blueprinting and preparation of the OSCE station, conduction of OSCE station, advantages, disadvantages and limitations and conclusions. Next slide. Next slide.
Yes, ma'am.
Introduction. So clinical evaluation is one of the major thing and it is never ever changed. So here, the responsibility of the teachers, we are facing most of the challenges. What type of clinical evaluation need to be carried out during a time of examination? Sometimes the teacher has to identify what are the different types of skills has to be checked, or we can call it as a competency. So it may be a knowledge, or it may be a skill, or it may be attitude. So variety of setting, the clinical performance has to be carried out. So one of the most important evaluating method to assess the clinical skills is called as objective structure clinical examination, or we can call it as evaluation also. So here, when we talk about OSCE is a station-based exam introduced in the 1970s by Dr. Harden and his colleagues to assess the clinical competency among the medical, nursing, and allied health students. Usually, the OSCE will be conducted among the nursing students, medical students, as well as IDL students also. Nowadays, it is a main practice. And in our INC syllabus also, it has been included. So continuously, the PG students, it is very compulsory. And nowadays, the UG program also will be compulsorily has to be conducted as the examination. Next slide. Some sound is coming now.
Yes, ma'am. Yes.
So we talked about the definition. It is an approach to the assessment of the clinical competency in which the component of competence are assessed in a planned or structured way with attention being paid to the objectivity of the examination. Here, we are not assessing the complete competency. So here it is only the compartment. That means only the particular station has been identified. So when we talk about the traditional way of examinations, the student will be carrying out complete physical examination. Instead of the complete physical examination, here the students will be observed only the particular assessment. That means cardiovascular system, or it may be only the nervous system, or it may be abdomen, only assessing the GA system. So this will be that competence will be the compartmentation component of the competence has been assessed. It is not complete thing. So that is the major thing. So we can identify where the students will be lack in particular skills. So it has been given by Harden 1975. The OSCE is a form of performance-based testing used to measure the candidate's specific clinical competence. So we can assess the specific clinical competence among the nursing students. Next slide. So evidence of OSCE, here we can come to evidence as OSCE in case of the pyramid of competence, that is Miller 1990. He has given a framework that identify the stages of the students should achieve. What is the achievement of the student? It is based on the pyramid. So especially the novice students to experts, the student must acquire the knowledge, skills, and attitude. So this pyramid will be exactly will be matching with the uh, skill of demonstration of learning. So especially according to the Miller pyramid, knows how and shows and does. This shows will be completely will be along with the stimulation and demonstration of the learning. So we are having a evidence that competency has been assessed. The students will be demonstrating the procedures based on the learning. Next slide. OSCE gold standard for performance. Here the OSCE will be very valid and it is very reliable and feasible. It will be we can carry out very feasible. It can be identified to everybody and we can find it out very easy. So it is feasible and it is fair in use and acceptable method, and also it will be completely the student can give the feedback and the teacher also can give the feedback, and it will be promoting the educational impact. So that's why it is one of the major component we can call it as. So this all can be a purposes for ASCII. So it is very reliably we can use and very flexible. So anytime we can carry out also. Next slide. Sonal. Content and process of ASCII. During an ASCII, the candidate are observed and evaluated by the examiner as they process through various structured series of station. That means one station first, it may be the teacher's knowledge, they may keep 10 station also. So each and every stations that 10 student has to pass through it with the standardized patient. Sometimes we need to assess the patient, but the situations in the lab setting, it is not possible. So what we have to do, we have to identify the senior batch students or the same student, those who are not having an examination during that time, they have been called. But before the priorly, they should not be informed, and we will be calling for the helping students for the examination. At the time of the examination, they will be act as a patient, and sometimes we will be giving a according to the scenario. Sometimes the student must be trained Even the trained students can be given, or the faculty members can be given the scenario previously, and they can prepare and come. So this is called as a standardized patient. So some of the specific tests, what all the tests can be conducted. So what all the competency has been assessed means some of the specific skills are included here is interviewing, communication, clinical judgment, physical examination, interpretation of the lab results, and simple procedures, sometimes communication, attitude, etc. So sometimes the teacher must be given with the standardized checklist. For each procedure, the teacher must given a specific checklist. Based on this checklist only, the student must be evaluated. So there is no problem when the teacher, there is no observer bias also here. The teacher will be identifying what type of skills has been performed by the student and what type of skills they have not performed. Everything they can identify individually to among the students. So this will be very clarity among the teachers and the students also where they are lagging. And all the students are presented with the same test for a particular day and systematic feedback obtained from the students and faculty. Here what we supposed to do, all the test, same test. So here it is not possible depending upon the student number. Here if it is more than 100 students are there, it is not all possible within one day. Sometimes what we have to do, 2 or 3 sessions has been conducted and the faculty and the students feedback has been given to the people. Coordinator of the examiner, or sometimes the teacher can evaluate also. So OSCE circuit, when we see the OSCE circuit, here 10 OSCE station has been given. So each station, one student will be standing and the student will be moved to circle wise. Sometimes the large classroom has been taken, or sometimes 2 or 3 rooms has been selected, and based on that it can be categorized. So it is very difficult for finding the location means you can keep 2 labs, or sometimes it is a single lab with the larger surface area can be covered it up. So each 10 students will be standing, first student, second student, third student, and once after the 5 minutes, the student has to move. In that first station, students will be moving to second, and the 10th student will be going to first. So this will be the common circuit will be carried out. Next. Component of the OSCE. When we talk about the major component of the OSCE here is the coordinating committee. The coordinating committee is having a major identification who are the members will be involved and which group of students will be involved, and what are the other type of station has to be kept. Everything will be identified by the coordinating committee. So the examination coordinator will be kept separately, and list of skills, behavior, attitude to be assessed, and criteria for scoring assessment. Here it is a marking scheme of checklist. What type of checklist has to be made? It may be a Likert scale, or maybe the scoring system has a global rating. Sometimes we, in case of communication station, will be carrying out the scoring, will be carrying out the rating, global rating. So it may be a binary items, or it may be a global rating that has to be identified. Then examinees, examiner, examination site, and examination station, time and time allocation between the stations. Then sometimes the models, required models are needed, breast, pelvis, or it may be rectum, or any other instrument is needed in that conditions. Everything has to be identified. Next, coupled station. Sometimes couplet station will be there. That will be one teacher will be standing and 2 station will be clubbed. So first station and second station and third. So when you are keeping a couplet station, sometimes it is very difficult to managing the time. So what we supposed to do, couplet station, when you are planning, each and every station will be, all 5 stations supposed to be a couplet station. Or otherwise, if you are keeping one station, then the students will be standing in between. So that's why, for avoiding these kind of time management, what we supposed to do, all 5 stations supposed to be a couple of stations, then there is no problem. So one procedure they can see, and the next will be the question writing they can sit and do. Or sometimes 2 observed stations also will be carried out in couple of station. Then examination questions, then environment of exam station, examination station circuit, how it has to be moved, then a standardized patient, or it may be a stimulation patient, then instruction to the patients. Okay, so how they have to behave, timekeeper, time clock, and time signal. Then contingency plan, what type of plan has to be made, very it is flexible plan we have to have. Then assessment of performance of the OSCE, so how it has to be evaluated. Everything will be the component of the OSCE. Next. The types of OSCE. So this will be the major category, how we are going to devise the OSCE. So main important thing will be the procedure station. That means observed station. Here the teacher will be available. So that's why we can call it as a manned station also. Sometimes the question station or response station, or it may be a unmanned station also will be there. And if it is more than 10 stations is there, we can keep rest station also. So the response station, procedure station, and the rest stations commonly we are carrying out. Take an example in case measuring the chest circumference of the newborn, the checklist has to be prepared by the teachers or the exam coordinator. Next. So here for the example, chest circumference measurement checklist, what we have to go? Here we have to have the different types of skills. So remove the infant cloth, whether the student can removing, okay, and supine position they are making a, then nipple line they are measuring, how exactly they are measured. So these kind of steps of procedure has to be written, and this will be in binary manner. It has been done completely or not done. So both the things will be there, and followed by the finally the faculty member will put the signature. So this what type of steps we are keeping that the students may not know. So that's why we have to be very careful when we are preparing this checklist, and we can keep the binary maybe done completely, not done, or sometime adequate, inadequate, yes or no. So all those things can be categorized, or you can add third one. It may be a done completely, not done, incompletely done, done completely, incompletely done, or not done. So in that case, done completely is 2 marks. You can keep incompletely done is 1 mark, and not done is 0. So this also can be prepared. So this according to the exam coordinator can be made it. So the 5 mark if you are keeping, it is well and good. Okay, so it is easy for the correction, as well as the student can be able to understand. It is a simple concept. If you are giving, the student can be able to finish it fast. Okay, next. So procedure station, this is another example. Perform simple if you are giving, the student can be able to understand. If it is too big scenarios, they can't understand, and it is very difficult. The time also will be the time will be running. So that's why the student will be very stressful when they are moving to the station, and bell will rings, immediately they will be start profusing. So that's why perform physical examination of the cardiovascular system. It is a very simple statement. Next is Mr. Anand had a known case of diabetes medicine, demonstrate the skills in administering injection insulin 10 units. So we are not giving where we are administering subcutaneous, we are not giving, but sometimes you can mention the subcutaneous site also. So it is nothing harm, but sometimes demonstrate the insulin administration procedure 10 units. That's enough. So this will be the very easy method for constructing the station scenario. Next. So already I have been told the checklist previously I have shown about the measuring the chest circumference. Here checklist I have given with the roll number, that is you can because sometimes the paperless work we are nowadays we are following the paperless work. In that case, what we can do, the roll number can be written in the left side, and all the items, whatever the skill has to be steps has been carried out, no, all the steps has been written in the row wise, and the total score has been performed. This will be for the, if it is very less than 10 students means each students we can use the single checklist, but it is very difficult to use it. So in that case, what we supposed to do, we can have with the roll number, and the what are the steps can be written in that, everything can be written in the roll wise. Okay, so this will be the major important checklist when we are preparing for overall students. Okay, next. Next, second is the response station. I have been told that the procedure station is over. Next is the response station. So here I have given an example for identify the congenital anomaly of the newborn. So here 1, 2, 3, the student has to be given a paper. So when they start writing, one is gastroschisis, second is meningocele, third is third is that is cleft palate, cleft lip, as well as cleft foot. Everything they will be writing it. So this will be major important thing when we are giving a recitation. So student must be given when they are entering itself. We supposed to give the paper. Okay, so each students when they are observe the station, they will be do the procedure, and sometimes the recording the procedure will be carried out. Then followed by each station name, they have to code it, and based on that they will be putting the all the reply. So this will be the paper station also, the response station, paper station, or unmanned station. Okay, next. So response station, again, I have given a clue. I have given an example. The scenario has been given. The newborn baby for 37 weeks. Mother is positive and negative. Mother is a positive and baby is a negative. After 48 hours of birth, the total bilirubin level was 14. So the task has been given. Identify the need of phototherapy by using AAP chart. That is American Academy for Pediatric Phototherapy chart has been given to the students for keeping the plot or making a plot in the AAP chart whether the phototherapy is needed. Then describe the physiological jaundice for 2 months and write the care of the baby during phototherapy is 2 months. Okay, so this can be kept. In case of the response station, you can also plan some of the instrument can be kept, and the student can identify all the instruments. So that also 5 instrument can be kept. Okay, so the students can able to write the 5 station, and you in the you have to mention the label in each instrument 1, 2, 3, 4, 5. Then correctly whether they are writing or not, that you can check it out. That is also a response station. Sometime interpretation of the findings. Some findings if you are giving, so you have to code it whether that values are showing, whether it is increased values or higher values or what type of diagnosis also they can write it. That also the response stations. Or you can give a calculation, simple calculation, fluid calculation, drug calculation, everything you can give it in case of the response stations. Okay, next. So this is the AAP chart. The student has to be given along with the along with the paper. It has to be attached. So here the student will plot it. So whether it is needed or not, they will be writing it here only. Okay. Then next, the recitation. Here, the recitation has given to the candidate or observer or the simulation patient to take a break. Okay. So in this here, sometimes the student has been given time for recollecting the things. Okay. So before the exam, before the observation is there, next station, progressing to the next station, the student can identify what all the things has to be done, or sometimes they may left some of the response station they have not written, so that also has been allowed to take allowed to write, or sometimes they can sit comfortably, or sometimes snacks has been provided. In case of the 12 station or 20 stations are there more, so those situations they will provided with the snacks, or sometimes water also will be provided. Okay, thank you. Next, OSCE setup. Okay, so OSCE setup, here the number of stations will be vary 12 to 30. Sometimes usually 20 stations will be sufficient. But in our nursing situations, in our NIMANS, we are following 5 stations only. Each 5 station, 5 minutes only we are conducting, 25 minutes. But higher classes, we can keep 10 OSCE also, 10 OSCE stations. It is depending upon the university or depending upon the choice of the institutions. So the each actually time will be permitted for only 5 minutes. Sometimes you can allow to test for 10 minutes. If you want to identify or if you want to see the performance of the students exactly, so you can go for 10 minutes also. It is preferable. But usually, otherwise, the young undergraduate students are very highly stressful. So we are avoiding only. We are constricted to only 5 minutes, limited to 5 minutes time only. Then all the students will be begin the exam simultaneously. Previous slide. Please go through the previous slide. Previous one. Previous one. The previous one. Blueprint. Okay. So the entire that is simultaneously. Sometime one or more parallel stations. This already I told.
पता नहीं ऐसा क्यों हो रहा है संध्या मैम से पूछो ना उनको पता होगा
Large number of classroom has been there means you can have a single setup, or otherwise parallel stations can be arranged, or two
नो
sessions
मैम
second day, first day, third day, like that. You can go for 3 or 4 days examination also can be conducted. The entire exams will be completed within 60 to 150 minutes. Okay, next. So blueprinting and preparing the stations. So once we have
नहीं बोला
confirmed
था
the
किधर है आपका हुआ
model, please
सॉरी मैम सॉरी
previous slide, previous one,
प्रीवियस वन
previous one, yes. Yes. So once we have identified what type of station has been there, so we have to start formulating the questions and the model keys and the checklist for each station has to be prepared. And before we could plan the ASCII, we supposed to identify the learning objectives of the students in mind before we are starting constructing the things. Then each one of the content carefully planned against the learning objectives, that is called as a blueprinting. Here what all the skills has been identified and what all the skills has been tested and how it has to be and what are the different types of skills. It may be a knowledge or a communication or it may be related with interpretation. All type of skills has to be identified and what type of content and how many minutes and whether it is the manned station type of stations, everything will be included in the blueprint. So this will be given to each group of teachers, those who are coming for the examination, and it will be helpful for them to understand very easily. Okay, next. So this is the blueprint of ASCII station. Here the manned station. So type of station has been mentioned and program component, whether it is what type, that is a content type. It is maybe the topic which has been taken from particular unit. Then item title, whether it is CPR, it may be oxygenation CPR or care of the wound means eye bandage. So what type of things, item wise title we have to give. Then competency we are testing, whether it is a therapeutic procedure or it may be data interpretation or it may be history collection or physical examination or diagnostic investigations or decision making, problem solving, everything has to be identified here. And also we are mentioning the domain where it has been. So first domain will be in therapeutic procedure, or second thing will be also therapeutic procedure, and it will be giving a clarity of information to everybody. So communication, examination, procedure and cognitive skills, everything will be mentioned with their specific skills, especially history collection or whatever it may be, everything has been specifically mentioned. The teacher can able to understand easily, so they are not missing particular skills. So each weightage has been given for all the areas. Okay, next. So next we are move on to the student preparation. This is the most important thing will be. So priorly we have to inform to the students. So be physically prepared. Okay, psychologically prepared. Okay, main important psychologically than the physical preparation. Be familiar with how instrument our equipment works. Know which procedure guidelines are to be used for ASCII. Be familiar with checklist and marking criteria and rehearse the skills. Always we have to rehearse the skills, know the timing of the ASCII. So we can conduct the mock or ASCII. So student can able to identify whether they are completing the task within the time and develop skills on clinical placement. So they are supposed to continuously develop each skills in their clinical areas. Okay, next. Revise the underpinning of the theory of skills. Okay, so each theory must be having a skills. Okay, so with that they have to prepare and they use a feedback. So whatever has been given by the madams during the time of mock examination or the formative evaluation, sometime we will be conducting the a model practical examination when the clinical examination got over. So that means the clinical postings got over, immediately we will be conducting one small model exam, then followed by before the university exams also some mock exams will be conducted. So the formative evaluation itself, we can give a conclusion. So these kind of problem, what are the problem the students are facing? So we will be giving a feedback during that time itself. Use available resources such as guided study, quizzes, and videos. Then check whether they would wear a uniform or not. Then confirm the date and time when you allow enough to get there. Okay, so we have to properly inform whether they have to wear an apron, all those things. Then practice answering questions verbally. They're supposed to have the conversation verbally. Okay, next. So the major component is the conduction of the OSCE examinations. So here it is conduction, it is a location. So conduction of the OSCE can be carried out in the large single room itself. Alternatively, 2 or 3 adjacent rooms can be used. So it will be 5 minutes. When they are transferring to one area to another area, sometime it will be. So take an example, if we have planned for 25 minutes for 5 students, so it may take another 5 minutes for changing here and there. Sometimes students they miss, sometimes the student will stand in one area. So much problem will be there. So 5 minutes we will be taking. So 30 minutes, that the duration for 5 students, it will be 30 minutes we have to complete it. So 5 minutes it will be delayed. That is the usual pattern. Finally, a station map is constructed. This serves as the most important tool and reference material for all further preparation. So they want to prepare everything. So automatically this map will be guide them. So how they have to move. Okay. So it has been outside only will be placed. So the student can, before they are entering, they can able to understand very clearly where they're supposed to move. Okay, so from the waiting room, the student has to go to the procedure 1, and next is the question station, procedure 2. So each one procedure station, then followed by question stations will be there. So the student has to move to it, and finally they will be exiting. So sometimes if it is more students are there, so what we have to do, the waiting students will be in separate hall and the examining students will be in separate hall. These students and the coordinating member will be standing there, and they will be sending the students to the hostel, or it may be some other room. As most of the time we will not keep the exam over students. Okay, so already completed students we will not keep in the particular area. What we supposed to do, we will be sending, or there is no missing of or mixing of the students here. There will not be a mixing, so automatically we will be sending the students to other areas. So once all of them are completed, then we will be called back. The when they are giving a feedback, we will be calling. Okay, so this is the major important examination point. Next, arranging the equipment and supply and manpower. Here we have to list all the equipment, what all the things are there, whether it is a needed mannequins or sometimes table, chair, okay, any water bottles or any other instrument, all lab things we have to keep it. Then followed by manpower, who are the members are coming for the examination. So who are the members are needed, examiners as well as some coordinate and committee people. Sometimes we will have a bell ringing person, once a separate person will be, timekeeper will be there for ringing the bell. So many things will be there. Then official stuff sometimes will be called. So mostly we will be checklist, everything will be prepared and keep it ready. In case if it is needed any other further information, so we can call the official people also. So it has to be we have to prepare the person as well as the equipment and supplies priorly. Then furniture and equipments also we have to keep. Sometimes the mannequins are mainly arrangeable, whether it is used or calibration we have to carry out before the doing starting of the ASCII setup, and everything will be working conditions that we have to see during the time of, if any problem is there, then the students will be very stressful. So that's why we have to avoid. We have to check priorly whether all the equipments and supplies are working properly. The condition of the equipments must be checked. Next, okay, and recruitment and training of manpower. So here examiner and observer must be chosen, and they must be trained properly. Okay, so whether they may be ASCII trained or sometimes they may be get the training from the webinar or any other things, so we can include them. Then it must be detailed information priorly we supposed to give, how must be what are the importance of ASCII, and how many station has to be kept, and priorly they supposed to give on the checklist, and they have to familiar with the checklist, then it will be easy for them to mark. And simulated patients also, what we supposed to give, we have to give the we are using for the communication station mainly. So in that case they have to communicate, so scenario script must be given to the patient, and they will be read the script properly, and unnecessarily questions when they are asking they should not answer it, so they should not put more questions also. So we have to be very clearly, we have to give the scenario, and we have to give the proper training to the simulated patients also. That is very much important. Sometimes the faculty members also used, already I told, sometimes students also can be trained in that case. So first year students examination, fourth year students can be called. Okay, but prior to the exam, only 5 minutes or 10 minutes prior to the exams only we have to call them in that situations. Otherwise, the students may tell, or sometimes 1 hour prior to the exam, because sometimes they should know what are the questions will be asked by the students. So that also they have to train. So it will be during a time of examination, not 5 minutes before. It will be 1 hour before we have to call them. Next. So final day of the ASCII, what we supposed to do? All the station setup must be carried out, and furniture and station must be station identification. That means station 1 and what type of procedure station. Station 2, what type of response station. Everything has been coded. So each paper will be having a scenario and also what type of stations, and final where the person has to move. Everything will be kept ready. Then exam coordinator must be come prior to 2 hours of examination, and observer or examiner must come for 40 minutes prior to the examination, and task questions are pasted on respective station 30 minutes before ringing the first bell. Then examiners also handed over all the checklists simultaneously. This will be on the day of ASCII. This has to be carried out. Next. So marking of the ASCII. Here, how the checklist has to be prepared. Here it has been, a checklist is frequently used to mark the ASCII to increase the objectivity and reliability of the students. So each student, sometimes it will be, why it is objectivity means there is no subjective comment. So everything will be observed by the student and it is reliable to the students. So sometimes if we are not making a checklist, what we will know, we will put, generally we'll put 6 or 7 marks. But when we are coding each and everything, so we can identify what skills they have performed, what skills they have not performed. So it is examiner bias also will not be there. So it is very reliable method of assessment. Then mainly we are using a binary rating. That means achieved or not achieved, yes or no, or done or not. Already I have told. So these kind of steps we can use 0 or 1. Most of the situation we are using yes or no also. Whether they have performed, concern with the mother, it is performed by the student, yes. So we'll put tick, or it is 1 mark, you can code it. If they are not done it, 0. So when they have not washed the hands, 0. So like that we can go with the binary rating. Then global rating can be used for communication and sometimes diagnostic task. In those situations only we are using. So what are the things, items we are using means exceptional, good, average, borderline, and poor, whether fail or not. That will be giving a very much performance of the student. So we can identify overall performance of the student. Here, yes or no, it is not giving a proper identity of the information. So that's why we will be going for global rating. Sometimes pass, borderline, fail also can be given. So this will be for the communication stations and the diagnostic task only. Next. So candidate briefing, already I have told. So continuously the student has to be informed properly, and registrations and everything has to be identified. Once the bell has been ring, the student has to move and they should not stop, and they have to wear the uniform. And most of the time the candidate must perform. They will be completely will be writing the things and they will not aware of the sounds. So once the sound has been ring, the students should not should move to the other area. Sometimes they may complete the exam, but they will be moving to the next session. It will not happen. So the student has to, once they completed the task also, they have to sit in the particular area. After the bell has been ring, then they have to move to the other area. So this will be happen once. Sometimes the student will be stand in one area itself, they will not move. Sometimes they will move fast. So both the things will happen. Then feedback. Once the ASCII got over, the student will be seated in particular area. You can give a feedback. Sometimes you can collect from the patient students, or sometimes the students will be orally will be given feedback. Or each and every students will be taken to the ASCII station only, and the teacher will completely tell the what are the common mistakes they have been done it. Everything can be carried out in case of feedback. Okay, next. So after the examination over, The observers are invited to comment upon the process and valuable input suggestions in order to identify the lacunae and strengthening the future exercise. So this will be, we will be calling all the observer. It may be 3 observer or 5 observers are there. So everybody will be called, and we have to tell the what are the problem they have faced. Sometimes they will not wish the teachers also. When they are entering with the stress, they may not wish their own teachers. Sometimes they will be without reading, they will see here and there. Okay, so they will not assess the what all the what where the station scenario has been kept. So many mistakes they will create it, or so they will carry out. So what we supposed to do, we have to assess all those things, and we have to tell the inputs, and we can identify, and we can collect the feedback from the observer. The feedback also promote the discussion to allow improvement in the station design, and complete marks list will be prepared. Okay, the next day, the maximum minimum average score for the individual station. For each individual station, it has to be prepared and followed by, we have to put a complete master sheet for the entire ASCII stations. Okay, next. So here is the ASCII station. If you have kept 5 stations, so each station separately you have made a each station. So each teacher has been evaluated, and the response station, sometimes you can keep the observer also during that time, and they can correct their responsibilities correcting the paper only. Sometimes the coordinator can overall coordinator, exam coordinator can correct one station. So that also is possible, because meanwhile when they are sending the students, sometimes they will be standing, that time they can correct it. So this also is possible. The response station, then and there you can correct it with the exam observer can be kept, or sometimes you can, once the exams got over, the allotted people has to correct the particular scenario, and they supposed to give. So finally 1, 2, 3, 5 stations has to be in code, and for 25 mark how much has been obtained by first student. So this is the overall mark sheet has been prepared, and finally who are the members are involved in a station, everybody has to sign it and with the date. Okay, next. So coming to the advantages. So these are all the way we are completely conducting the examination. So coming to the ASCII, so variety of clinical skills can be evaluated within the short period of time. Even you can keep a less than 2 minute station also, but it will be very young students. I mean, first year students can be carried out, but it is not for the higher educated student, maybe second year, third year, and all, they can keep a little more higher time. So short period of time, you can plenty of information or plenty of skills can be assessed. So it is a more valid one, because before we could send it for before we could do the examinations, so the content will be sent it for the validation, and the validation committee will decide, examination committee will decide what all the things has been kept, and the coordinator has been finalized. So the validation will be very good. So here more this ASCII is more valid, and examiners can decide in advance what to be tested, and the examination of the competency design also will be made. Then it is a more reliable method. Then examiners can have a better control on the content and a complexity. So they will have a control, because this sometimes it will be within the time period we can finish it. So it will be very controlled environment. We are not mixing with the other students, so the environment will be completely controlled. So it is more practical with a large number of students. We can use it. The objectives and standardized nature of this examination help to minimize the examiner bias also. This already I have explained. Okay, next. Disadvantages: complete evaluation of the examination is not possible. So compartmentalized skills, only the particular skills we are assessing. It is very resource insensitive, because we are needed so many members. Okay, when we are constructing, 5 teacher has to be there for 5 days, or sometimes 3 days or 4 days. It will be very distressing. The same skills only will be carried out by the students, and the same skills will be evaluated. Sometimes we will be changing, but continuously when we are sitting, it will be boring for the teachers also. So it will be too much of time consuming. So it is not easy within the time period, we cannot finish it. So it will take a resource incentive. So many members or so many equipments are needed, items are needed, mannequins are needed, everything we have to look into it. Then long time planning is required because it is not easy job. Sometimes when we are practically we are keeping a small stations, it is very easy. But when you are practicing, this also will be very easy. We cannot say it is a long time planning. It is a short planning, but we have to plan according to the ability of the students. Then demanding for both examiner and the patient. Yes, definitely it will be demanding. But patients will here the patients will not be used, but simulated students will be used or simulated patients will be used. Examiners are required to pay close attention to the students. Repeatedly watching the number of occasions will be boring. Then maintaining uniform difficulty level is not always possible. So sometimes it will be difficult in maintaining a uniformity. So that is true. Sometimes we cannot. It is not. Some situation it will be go beyond our limit. But most of the time we can control it. Then ASCII is stressful. So sometimes the first time when the students are going, when we are taken the perception, so that time they were very much stressful. But nowadays and all continuously we are keeping the examination, so the students are familiar with the examination setup, so they are learning. Then students behavior are influenced by the context. Sometimes students behavior, first day they will be very scared, and second day, third day and all some of the things when we are telling, no, so the students may be influenced. Okay, next, limitation. So require extensive planning and preparation on the part of the examiners. Yes, we need to have an extensive plan, and it is difficult without a team effort and administrative support. So we need to have a many members, administrative staff, and the team members are needed, and more labor and the time resources. Yes, it is correct. Then risk for observer fatigue. Sometimes continuously they will be evaluating the students, so this may produce the fatigue also. No clear cut standard for passing of examination. Sometimes there is no clear cut standards. So some people may follow the Likert scale, some people may follow anything else. So that is 25 marks or 30 marks or 50 marks also will be there. So passing of examination, there is no standards of setting. So that will be one of the limitations. Next. So what are the do's and don'ts? So the student must memorize the step, and always they should think of what are the steps has to be for each procedure. When they are knowing about each article, how the in the making the tray itself, how they are keeping, uh, they will be identifying each steps. When they are keeping the article result, they should know what step they have to follow. Okay, so memorize the steps and always suggest number of possible differential diagnosis. So they have to keep reading the scenarios more, then they can easily identify. Nowadays, scenario based examination or scenario based test only we are conducting. So the student should know different types of diagnosis. Then always practice, practice, and practice. That is the major thing in order to success in ASCII. Don't we should not be nervous and worry about minutes. Okay, sometimes they will be, don't worry about the minutes, and you supposed to follow whatever you know. Then don't hurt the patient or simulated patients. Sometimes you will be hurting when we are doing it fast, so you should not hurt the patient. These are all do's and don'ts of ASCII. Next, by concluding the topic, an ASCII provides a reliable, reproducible, and valid form of assessment. Used as a formative assessment tool, it provides a unique opportunity for effectively blending the teaching, learning, and evaluation methods. It will help the students to improve the clinical competencies. ASCIIs are used appropriately. They are valuable in assessing the students' performance and underpinnings knowledge of clinical skills. Okay. Hope you understood the topic. That's all I have finished the ASCII. Any questions?
वुमेन्स है अलग अलग डिपार्टमेंट है इधर तो हमें कितने सारे सैंपल्स मिल सकते हैं
Thank you, madam.
Thank you, Sonal.
Thank you, ma'am, for such an enthusiastic and informative session.
Thank you,
And,
Sonal.
okay. On behalf of Parul Institute of Nursing, Parul University, now I take this opportunity to thank Mrs. Sushila T for being the resource person for this webinar and sharing your knowledge and valuable time with us. My heartfelt thanks to Dr. Ravindra H.N. Principal, Parul Institute of Nursing, and Mrs. Vinay Kumari, HOD of OBG, and all faculty members for support and cooperation. I extend my gratitude to the IT department of Parul University for technical support and all students for the participation. Once again, thank you all for your support. Thank you, madam.
Thank you. Thank you, one and all, for making me a resource person. Okay. Thank you. Thank you very much.
Thank you so much, ma'am. Thank you.
And what will be the objectives, ma'am?
No questions?
First one, I made this video.
No
Hello?
questions? No questions?
No, ma'am.
Okay.
Thank you so much, ma'am.
Okay. Thank you. Thank you. Thank you. Thanks to Vinaya also for being a.
Yes, yes, ma'am.
Okay. Thank you. Thank you, one and all.
Thank you, ma'am.
Have a nice day. Thank you.